Hey guys, it's your girl Rachel again. I'm rushing to get ready to go to work, but I wanted to talk to you guys about my experience with my first pap smear. Yes, pap smear. So it's a little TMI, so let's just letting you know. I went yesterday. My very first pap smear. Not a good thing because I'm 29 years old. But it had to be done because I was having some pain in my ovaries. So I was nervous. And I had done some researching on YouTube looking for other people's experiences, and can you believe I really didn't come across that many, and none of them were by African-American young ladies, and that's just to say that I'm sure that they're getting theirs, and I'm hoping that's true because it's very important to get it done, especially if you're above the age or sexually active. So anyway, went yesterday. I was fine up until I got into the room and I saw the cotton swabs. There's little, and they're like mega long. Like they're not like the little cotton so you put in your ear. Like they're really, really long. The spectrum, and there's this other tool that looks like a toilet brush almost. It's, it's small, but it looks like a toilet brush. All this stuff has to go and collect cells and all that kind of stuff. So all this stuff has to go inside, and it's great. I had a nurse practitioner who spoke to me, told me everything about the materials that were going to be used and what it was going to be collected for. At your pap smear, they usually do, from what I'm told, an STD testing, like gonorrhea, blood is taken for syphilis, HIV, all that good stuff. So, and being that I'm, I guess of age, the first thing they ask you is, you're well overdue, what took you so long, scared, nervous, and I didn't get one when I was younger, when I first learned about pap smears because I wasn't active, so, and it wasn't pressured on me either. What else? So you undress. At my particular screening, I took everything off. We did a breast check and touching on the belly, making sure everything felt fine, and then time to check the cervix. So you have a spectrum. I don't have anything that I could, show you what it might look like, but it's about this size, really, really small. And it's inserted, and then it's opened. You don't feel the spectrum open. You hear it, which might make you a little nervous, but you don't feel it opening. It opens, which allows the nurse practitioner or the doctor to take a look at your cervix. Then the cotton swab is put in, and it's twirled like that. Same thing with the little, now the cotton ball swab, and there's another little utensil that looks almost like a spatula that's taken, as well as a little toothbrush thing, toilet brush thing. And I have to tell you, for me, some people said they didn't feel it. I felt that instrument that looked like the toilet brush on the uterus, it kind of contracted, which she told me that some people feel, and that's what it'll feel like, and I felt it. And that's it. It took yeah, that was it for the spectrum and the cotton swab and stuff. That was all done. And she takes, they could take 1 to 2 fingers, insert it to feel your ovaries, your uterus, the position and all that kind of stuff. So glad that everything is fine, positioned well. My cells cancer cells and all that kind of stuff, test results will come in. Normally they say about almost 2 months. If it's abnormal, you know, they'll contact you. If it's normal, you know, they may or may not contact you, depending on, you know, your doctor or clinic or wherever it is that you go. But it's very important to go and get that checked. It's not as bad as you would think. Trust me. Okay, trust me. Look, trust me. I am worse than a child at a doctor's office. I mean, look. I'm still walking around with the Band-Aid. I have 2 Band-Aids on, actually, on my other arm. Still walking around with the Band-Aids on, with them trying to draw blood from me. And, you know, I just took the Band-Aid off my finger. I am awful, and I do a lot of talking when I'm nervous. So, my STD testing won't come back until about 2 weeks, which I know I'm good on that. But it's something that they do. It's very important to take care of yourself, to take care of your body. I wish I could show you the instruments. They were really small. It took like 2 minutes. She was like really nice and talkative. And even though it's not the best time to have a conversation with someone, whether down there looking at your hoo-ha, it eases you. If you're like me, it eases you. You know, you're breathing, you're talking, you're trying to take your mind off of it. You don't feel like anything. And like I did, I mean, I felt the, like I said, the little instrument that was like a toilet brush. But other than that, like I had no idea the cotton swabs were in and out because I didn't feel anything. The finger, she only had to put 1 finger inside. Sometimes they'll take 2, but she only had to do 1. And pressing on your stomach and making sure everything felt fine, you know. It was fine. Everything was fine for me. Pressure is the only thing that I could say. It wasn't painful at all. If you were going to equate it with something, it would be like someone pushing against you, you know, while you're trying to push back. That feeling that you get, it's not painful at all. And it's done just like that. Your clothes are put back on and you're on about your business. So I wanted to share mine, and I was going to do it last night, but I got off work so late. I got off at midnight, and by the time I got home and settled, it was almost 2, and I was just beat. I was just beat. So, yeah, that's it. They give you, you know, whatever it is that you need, but it was really quick. For those of you who are active, I don't think, you know, because you're active, you pretty much have an idea of what it might feel like. But for those who are not, you might use the word painful, but it isn't. It's very, and it doesn't take long at all. And you want to get somebody who's patient and talks with you. I did see, however, on one video that there was a spectrum that was metal, which is really, really cool. But for the most part, from what I've heard and what was used on me, it's plastic, and it's not cool at all, or nothing. So that was my experience. That's all I have for right now. Since I gotta go ahead and go to work. My poor arm. But other than that, like I said, it was fine. She was really nice. Talked to me first, made me feel comfortable. That's the kind of traits you want to look for in your caretaker. Someone who will talk you through it and ease you into it. But yeah, so, and you get your results back later on. You know, if you're in that window where you're not sure about stuff, always, if you're active, always protect yourself unless you and your partner are trying to conceive and are exclusive, and there's like nobody else to worry about any STDs. But be very careful and mindful of those things. But I'm gonna go to work now, and I'll talk to you guys later.